So you can start the video and turn this side like this, auto rotate. Yeah. Hello and welcome to Seven Sentinels.
Good evening, sir.
One second. Our autopilot did not show in. So here is our card. Yeah, our autopilot has come. So, artificial intelligence. Yeah. Hello and welcome to Seven Sentinels. This is Grandmaster Class and I'm Peter Simon with you. Today we are conducting speaking sessions, a marathon race, a number of speaking sessions we are going to handle today. And we have the doctors and nurses, okay, more nurses and a few doctors we have, and we are taking speaking sessions. And now we have Durga Bhavani. She's a nursing tutor, nursing trainer, educator from Hyderabad. Okay, so right. So this is the card here. This is the speaking card. It's a squamous cell carcinoma. And yeah, this is a nursing specific speaking card. Right. Yes. Yes, you can start now, Durga Bhavani.
Yes, sir. This card is a follow-up care visit. So may I know the how may I address you during the role play, sir?
My name is Michael Jackson and I'm 51 years old.
Okay. Hello. Good morning. Good to see you again. My name is Bhavani. You are attending nurse here today. How are you doing, Mr. Jackson?
Nurse, what should I tell you? Right. Yeah, the doctor told me that I had something called squamous cell carcinoma, and I don't know this big name, but I think it's something like a skin cancer, just another name, and I'm a little bit worried about that, nurse. Can you please give me a detailed picture of what it is?
Definitely, Mr. Jackson. I can understand your anxiousness about your condition. For your better understanding, I will definitely explain it to you clearly. Shall I proceed with that? About
Yeah, of course,
explaining?
nurse.
Yeah, Mr. Jackson, how much you know about the squamous cell carcinoma so far?
I don't know anything about this, nurse. Just the doctor has
Okay,
told me, and I'm coming
okay.
here, and I want you to give me a clear picture.
That's understandable, Mr. Jackson. So, before we start, I just want to know you about the squamous cell carcinoma. It's a general skin cancer which is caused by the sun exposure. So, squamous cell carcinoma is a type refers to a type of cancer which affects the squamous cells. That cells will be make up the outer layer and inner layer of the skin. I hope you I make clear to you, Mr. Jackson.
Yeah, I can say that I have a better understanding of what squamous cell carcinoma is now, and I would like I want to know whether I'm likely to need more surgery to remove the other lesions in the future.
Yeah, I'm afraid about that, Mr. Jackson. And there is a doctor who done the surgery for you. That doctor will help you with that. He is knowledgeable in the about procedures, everything. So in your condition, he knows everything about what particular thing you need to go for. So better to meet the doctor. You will get all the queries related information.
Um, Yes, what's going on, nurse? I don't understand. What's the problem, and what am I supposed to do now? What is the reason
Don't
for this?
Yeah. Don't worry, Mr. Jackson. I'm really concerned about your health. I definitely help you to understand about your situation. So don't worry. Here, what I'm going to explain it to you is you need to do some precaution. You need to take some precautions to prevent further damage of your skin. Are you willing to do that if I explain it to you about the precautions?
Yes, nurse, definitely, but yeah, what precautions I have to do, I don't know. Actually, yeah, tell me, nurse, please explain me in your own
Yeah.
words.
Before going to explain it to you, I just want to know about your habits while you are in the sun. May I know the things which you are following?
That's good. That's good. Thank you for asking. I always wear a high factor sunscreen, 30 or higher. I wear a hat when I am out in sun, but I think it's too late because the damage has already been done. I spent too much time in the sun when I was in my teenage years, and maybe that was the reason. But it's finished; it's done and dusted forever. So I have to take some remedial measures. That's all.
Yeah, I agree with that, Mr. Jackson. But here, the few more things you need to know. Your skin is already damaged, but it got ruled out with the surgery. So you need not to worry about what happened already. So for prevent further damage and prevention of the further skin loss, you need to follow same things which you are following already. That are absolutely necessary with a appreciable thing which you are following, hat using and sunscreen lotions, whatever you are following before. So do follow all those things which will be more beneficial in the future. I hope you are following me, Mr. Jackson.
Yeah, of course, nurse. I'll make sure to look after my skin from now on. And yeah, so what's the thing now? What are we going to do?
Yeah, along with these precautions, you need to do a few more things, Mr. Jackson. I'm really appreciating your question. Here, what I'm explaining to you is you need to follow the some measures to prevent the further damage and to prevent infections on the wound. So as you know, you underwent a lesion removal surgery that is already got sorted out. So here, what you should do is you should clean your skin whenever you are touching, and you should follow all the hygienic measures to prevent further infections and to promote a good healing process. I hope I'm clear to you, Mr. Jackson.
Yeah, you're absolutely clear. Everything understood. That's absolutely fine explanation. And okay, now what about this wound? What am I going to do now with it?
Yeah, now you are in a good healing process. So usually stitches should be removed after 7 to 14 days of time. So your doctor is clearly assessed your wound and he recommended suture removal. So now you are here to remove your sutures because your wound is absolutely recovered. So I'm ready to remove your sutures, but I need your consent to remove the sutures.
Nurse, the wound has been fine. It's going on well. I think it's improving, and there's no pain and there's no discharge. But I still think, is it right time to remove? Can't we wait for some more time? I think it's too early to have the stitches out. What do you think, nurse? Can't we?
Well, Mr. Jackson, as per your understanding and explanation, what I understood is you are not having any signs and symptoms of wound pain and discharge. Am I right in that?
Yeah, of course, nurse.
Yeah. So in this case, if you are not experiencing any symptoms, it indicates it's a good healing process. So, as per the doctor assessment, it is confirmed your wound is completely healed. So you need not to keep the sutures few more days. Once wound is healed, we should remove the sutures and it should be keep in an outside environment. It should be exposed to outside environment to get the proper oxygen and air to the wound. Then it will be completely clear and it will be recovered completely, and you will not experience any scars anything if you keep like that.
Okay, nurse, I understand. So if it is well and everything is perfect, and it is your suggestion, you know better. So I am ready. I give you my consent for the stitches to be removed. Thank you very much, nurse.
Thank you, Mr. Jackson. But before removing the sutures, I want to confirm one more thing. During after the surgery, during post-operative period, how you feel about the surgery, and do you experience any kind of difficulties due to this wound?
No, nurse, everything is fine. Thank you very much.
Thanks for the clear information. And now I'm going to remove your sutures. Please give a consent.
Thank you very much, nurse.
Thank you.
Right, that's the session we had with Durga Bhavani, nursing educator from Hyderabad. Fine, that's a very good. Bhavani, you have done a good job. There are some things which we have to get feedback. So what I'm going to, the first part is done. This is the role play session. We have done it. And now that's the end of the session. And next I'll call you for the correction because my artificial intelligence is already there and it is going to type everything and it will use it as a dialogue, and I will be correcting your speaking every line, word after word, line after line, and I'll send you the booklet shortly. Thank you very much. And anybody who is interested in speaking sessions, you can contact me personally on my telephone number 9877867360. I repeat, 9877867360, and the name is Simon Peter from Grandmaster class.